My name's Sarah, and I'm going to be the nurse practitioner student taking care of you today. Can you tell me your full name and date of birth?
Taylor Plano, 5/13/94.
Okay, and do you know why you're here?
I'm having some right knee pain
And where are you right now?
in the hospital.
Okay, and what year is it?
2018.
Perfect. So patient is a 24-year-old Caucasian female, alert and oriented times 4 to person, place, time, and situation. She's clean and well kept, no odors noted. She's dressed appropriately for age, gender, culture, and weather. Her chief complaint today is right knee pain, so I'm just going to continue on to my history of present illness. So first I'm going to ask about onset. So when did this pain start, and was it sudden or gradual onset?
It started last night at my soccer game and it was pretty sudden.
Okay, and then where at and on your knee is it
It
hurting?
feels like it's behind my kneecap but still in my knee.
Okay, and just the right knee?
Yes.
Okay, and then duration, so how long has this been hurting you?
Pretty constant since it happened last night about 6 p.m. So almost 24 hours.
Almost 24, okay. And then the character of the pain, so can you describe it? Is it throbbing? Is it dull, sharp, stabbing?
It's just kind of like an intense throbbing pain, but whenever I get up and try to walk on it, it kind of feels like my knee's giving out.
Okay, so she's having some instability in that right knee when she weight bears. So then any aggravating factors, so anything that makes it worse?
I'm moving it, walking up and down the steps.
Okay, so definitely weight bearing on that right leg. And then any alleviating factors, anything make it better?
Ice kind of helps a little bit. I keep it still propped up on a pillow, and I've been taking ibuprofen.
Okay. And then does it radiate anywhere?
No.
And then timing, so what happened around the time that, so at your soccer game you said, what was going on? Were you running? What were you doing at this time?
I was running down the field with the ball. I turned towards the goal, and when I changed directions, I heard a really loud pop.
Okay, so it sounds like you had like a sudden change in direction, probably a stopping force maybe, and you turned directions. Okay, and then severity, so on a scale of 0 to 10, 0 being no pain, 10 being the worst pain ever, what would you rate this pain?
It's about an 8.
Okay, so now I'm going to move on to history. So any medical history for you? Any diagnoses? Nothing? Any surgeries?
Tonsils about 2 years ago?
Okay, and then any daily medications that you take?
No.
Did you take, and you said you took ibuprofen for this. How many milligrams?
I took 3 pills, so 600.
600 milligrams, and when was that?
About 2 hours ago.
2 hours ago, okay. And then any allergies that you're aware of?
No.
No drug allergies, okay. And then social history, so I'm going to ask about tobacco use. Do you
No.
smoke? No. And then any illicit drug use?
No.
And then alcohol use? Do you drink?
Just socially on the weekends.
Okay, how many times a week would you say?
Probably 1 or 2.
Okay, and how many drinks? Just
2 maybe.
a couple, okay. And then are you in school or do you work?
I'm a full-time student.
Full-time student, okay. And then who do you live with at home?
Right now I live by myself.
You live by yourself, okay. Perfect. So there's social history. Now family history, talking about mom, dad, any kids that you have, or any siblings. Do they have like heart disease, cancer, diabetes, stroke, any history like that?
My mom has diabetes and my dad has high blood pressure.
Hypertension for dad and diabetes for mom. Okay, so what about siblings? Do you have any siblings?
Yes, but they don't have any.
No medical history for them. And then any children?
No.
Okay, so no significant medical history besides diabetes and hypertension. So next I'm going to go through a review of systems, just to make sure I'm not forgetting anything that the patient's telling me. So have you had a fever or anything recently with this injury? No? Okay, so no fever. I'm also going to ask about a neurologic exam. So when this happened, did you fall? Did you hit your head on anything?
I kind of fell to the ground because of the pain, but I didn't hit my head.
You didn't hit your head. Did you lose consciousness or anything? No. Okay, and patient's alert and oriented times 4, talking to her. Her speech is clear and articulate. She doesn't seem to be having any neurological deficits, and she didn't lose consciousness. So then I'm going to ask about any like lightheadedness, dizziness, blurred vision, nothing there. Okay, so we're not worried about anything neurologically. And then peripheral vascularly, we'll talk about numbness or tingling in that right leg or foot.
Mm-mm.
Nothing,
Just the pain.
nothing abnormal. Okay, Perfect. So moving on, that was your view of systems. I'm just gonna do vital signs. So we did her vitals. She was afebrile with 98.6. Heart rate was 89. Respiratory rate was 16. Oxygen saturation was 98%, and her blood pressure was 122/72. So nothing going on there. Next, I'm going to inspect. So first, I'm going to have her walk across the room and look at her gait. So I can just have you hop off the bed if you don't mind. I won't have you walk far because I know it hurts to move. So if I can just have you walk this way for me. And she is limping, putting most of her weight on that left foot. Definitely guarding that right knee. Okay. Perfect. But gait seems steady. She just has a slight limp. So next, I'm just going to inspect the knees. So we can just sit here. I'm just going to roll up your legs, or your pant legs if you don't mind. So I'm just inspecting the knees bilaterally, looking at color, symmetry. They look symmetrical. The right knee does look slightly swollen compared to the left. Other than that, there's no redness noted, and no other abnormalities or deformities noted there. Next, I'm going to do palpation, so I'll actually have you lay back if you don't mind. So I'm just going to palpate, starting with the unaffected knee first. So first I'm just looking at the patella and then palpating around that. Any pain or tenderness, just let me know. And then I'll have you slightly flex, and I can feel the patella tendon. And I'll just go down that. And then I'll find the joint line, and we can straighten it a little more. And I'm just palpating along the joint line. No pain or tenderness, no warmth noted. Like I said, no redness and no swelling to that left knee. So next I'm going to do the affected knee. And so I'm just going to start by palpating the patella. Is there any pain there?
Yeah.
Yeah, so some pain and tenderness. And then I'm just going to palpate along the joint line. Pain or tenderness, a little bit, yeah. And then I'm going to have you flex a little bit just to feel the patellar tendon. And I'm just palpating down that, and that's okay?
Hurts
a little bit, okay. And then I'm just feeling there is some swelling noted, no redness, and really no warmth compared to the other side. So next I'm going to check range of motion. So we'll start with the unaffected leg first, and we're going to do flexion first. So slide your heel up towards you as far as you can. Okay, and I'm going to apply some slight overpressure. Any pain there? No? Okay, I'm going to have you straighten, and I'm going to test extension with the towel roll underneath her calf. So straighten it as much as you can, and I'm going to apply some slight overpressure. Good, any pain?
No.
Okay, next I'm going to do the affected leg. So I'm going to do flexion. So I'm going to have you slide your heel as far as you can up. And that's as far as you can go. Okay, so definitely limited range of motion for flexion. Now I'm going to do extension. And I'll have you straighten it as much as you can. Any pain with that? Okay, so pain with flexion and extension. I'm not going to do any overpressure for flexion or extension. And I am not going to test strength because she's having pain in that affected area. So I'm not going to test strength right now. I am just going to move on to my special tests. So first I'm going to start with the ACL. So I'll test your unaffected leg for each test, and then I'll move to the affected leg, and I'll just compare sides. So I'll start with the Lockman test. So what we're going to do, this is testing the ACL, so we'll slightly flex here, and then I'm just going to stabilize here, and I'm going to pull forward, pull the tibia anteriorly. And I don't know any laxity there and any pain, no pain noted. So then I'm going to do the same thing, the Lockman with the affected leg, so slightly flex. And I'm looking for laxity and any pain or tenderness. So I'm going to pull anteriorly, and you're having pain with that one. So pain with the Lockman, and definitely increased laxity for that test. Next I'm going to do for the ACL, anterior drawer, and I just find the patellar tendon, and I'm pulling the tibia anteriorly, checking for laxity and pain. Any pain with that? No? And while I'm here, I'm just going to do the posterior drawer to test for the PCL, the posterior cruciate ligament. So I'm just same position along the patellar tendon, but pushing posteriorly, checking for laxity and pain. Nothing. Okay. So then I'm going to test the affected leg for ACL for the anterior drawer, and I'm sitting on the foot and finding the patellar tendon and pulling anteriorly.
Yeah.
Pain with that, and definitely increased laxity compared to the left. And then I'm going to do the posterior drawer testing for the PCL, and I'm just in the same position, pushing posteriorly. Any pain with that?
No.
Perfect. Okay, so next I'm going to do the MCL and the LCL. And so we're going to do varus and valgus. So I'm going to slightly flex and do, let's see, so we'll do valgus first. So I'm going to stabilize up at the thigh and then apply a valgus stress and look for any pain or laxity.
No.
Nothing? Okay, no laxity noted. So then I'm going to do so that was varus. And then I'm going to do valgus.
No.
Nothing there. Okay, and that's testing the MCL and the LCL. No pain or laxity. So then next over here, I'm going to do the valgus. So I'm testing the MCL. Pain with that one, and a little increased laxity. And then I'm doing the varus, and this is testing the LCL. So I'm holding here and doing a varus motion with this hand. And no pain with that one, and no increased laxity. Okay, last thing I'm going to do is the McMurray's test. And so what I'm going to do, this is testing for the meniscus, medial and lateral. So to test for the lateral, I'm going to have you externally rotate the tibia, and I'm going to hold here, and I'm cupping the heel, and I'm going to flex the knee and then extend. And any pain with that?
No.
No. Okay. And then I'm going to test the medial meniscus, and I'm going to do the same thing in a circular motion. Any pain with that?
No.
Nope. Okay, so now I'm going to test the affected leg, and I'm going to do external rotation and apply support here and do flex and extension, and then do it in a circular motion. And then lastly, I'm going to check the medial meniscus. Did you have any pain with that?
Yes.
Pain with that, and no increased laxity. Then I'm going to internally rotate and support up here on the thigh, and I'm going to do flexion and extension. Any pain with that?
Yes.
Yes. Okay. So pain with the McMurray's test, the Lockman's test, the anterior drawer, as well as the varus and valgus on the right leg. So now I'm just going to name my three differentials. So I would say the anterior cruciate ligament, so the ACL is a possibility because she had increased laxity and pain with the ACL tests, special tests. And then I would say MCL would be my second differential diagnosis because she had increased laxity and pain with that, with the varus and valgus. And then I would say my third differential would be the meniscus because she had pain with the McMurray's test. That's it.